Hello, my name is Nick. I'm a nursing student on 5A and I'm going to present a patient to you now. Patient is a 48-year-old married Caucasian male. His former job was as a computer technician at a college. Patient was an emergency department admit on 11/3 for pain in his perineum. During examination, physicians found a perineal abscess resulting in the patient's prior prostate cancer treatment. Patient underwent surgery on 11/5 to remove the abscess. Patient's incision is partially open, packed with sterile gauze, covered with 4 by 6-inch sterile pads. There is a Penrose drain exiting the inferior portion of the incision with minimal drainage. Patients state that he feels much better since having the surgery, which has alleviated much of the pain. Patient rates his pain while sitting, which as a 5 out of 10, which is incisionally and achy, located on his perineum. He states the pain can increase to an 8 out of 10 during wound packing and activity. Pain alleviating interventions include medication, ice packs, position, and distraction. Patient's vital signs are stable. Temperature is 38.6 degrees Celsius taken orally. Heart rate is 83. Respiratory rate is 16 with normal depth and effort. Blood pressure is 132/58 and pulse oxygen is 95% on room air. Past medical history. Patient has a history of prostate cancer, hemorrhoids, arthritis, anxiety, hypertension, obesity, diabetes, lumbar spondylosis, strain of lumbar paraspinal muscles, hyperlipidemia, and sleep apnea. All immunizations and flu shots are up to date. Patient has no drug allergies but does have hay fever. Surgeries. Patient has had a perineal abscess removal, prostatectomy, lymph node excision, PC prostate marker placement, tonsillectomy, adenoidectomy, and PC cystoscopy. Patient takes medications for incisional pain, depression, infection, thrush, bladder spasms, constipation, high blood pressure, inflammation, and hyperlipidemia. Functional assessment. Patient denies drinking alcohol, tobacco, and illicit drug use. Patient states he is only able to adequately sleep while using a continuous positive airway pressure machine. Patient denies drinking coffee and states that he eats a diabetically friendly diet. Patient has no need of safety device as he can perform all his ADLs without assistance. Psychosocial. Patient currently lives with his wife of 25 years in Brighton. They have 3 children who are 25, 23, and 12 who all live at home. He receives much of his support from his family. Patient attends church regularly as a coping mechanism, states that his religion is very important to him and identifies as a Christian. Other coping mechanisms are exercising on a stationary bike, walking regularly, and spending time with friends and family. Patient has a graduate degree from Wayne State University. Patient denies depression, body image issues, or any perceived stressors despite antidepressants, medication, and cancer diagnosis. Family health history. The patient's paternal grandfather died from a myocardial infarction at age 85. Maternal grandfather had hypertension and has had a stroke. Patient's aunt has lung disease since the age of 60. Brother has hypertension and high cholesterol, and his mother has hypertension and has had a stroke. Patient's brother, mother, and maternal grandmother are still currently living. Integument. Due to the patient's partially open wound and sensitive skin because of steroid use, ensuring the integument is properly maintained is important. If left alone, the skin could become overly irritated and wound may become infected, thereby prolonging the patient's recovery. Patients state that this dryness and sensitivity is new. Patient denies ever having any skin problems or infection. Patient denies having any sores or ulcers that are slow at healing. Patient denies any rashes, but states his skin itches when dry. Patient is not overly concerned with his skin as it is a result of his treatment. Patient does not spend much time in the sun and reports wearing sunscreen when he does. Upon physical examination, the patient's scalp was dry but free of flaking and lesions. Hair was sparse, white, and brittle over the entire body due to recent chemotherapy, but patient states that it was growing back. Skin was dry, clean, with no body odor present. Color tone was normal for the patient's race and with healthy pink, red tissue surrounding the incision. There were minor abrasions where tape had previously secured the patient's IV on the right forearm, nasal cannula, and tip of the nose. No pressure ulcers present. Skin was smooth with no lesions but thin. No turgor or edema was present. Nails were well groomed, color normal for patient's race, a capillary refill less than 2 seconds, and normal shape, contour, and thickness. Cardiac. Because the patient's recent sedentary lifestyle, coupled with hyperlipidemia and hypertension and a history of myocardial infarctions in his family, put him at risk for cardiac disease. Patient denies any history of chest pain, but does become easily tired after minimal exertion, such as showering or walking up and down the hallway approximately 80 yards. No jaw pain or numbness reported. Patient denies any difficulty lying flat. Patient states he eats a healthy diet but denies trying to lose weight. Patient denies having had any electrocardiogram, stress tests, or surgical procedures for a cardiovascular problem. Upon physical examination, no heaves or lifts were noticed over the 5 key areas, with no marked abnormalities of the contour of the chest upon inspection. No thrills or lifts palpated over the 5 key areas of the chest. The point of maximal impulse had no abnormalities when palpated. A normal S1 and S2 heart rhythm and sounds were heard upon auscultation at the aortic, pulmonic, Erb's point, tricuspid, and mitral areas. No S3 or S4 heart rhythms heard. There was a pulse rate of 83 while assessing the apical pulse with patient in the supine position. Pertinent system number 1. Due to the patient's corticosteroid use, his diabetic status, and a blood glucose of 123 and prolonged sedentary lifestyle while hospitalized, his peripheral vasculature should be assessed. According to the Allergy, Asthma, and Clinical Immunology, prolonged corticosteroid use can increase a patient's risk for hyperglycemia substantially. This, combined with limited activity, could impair the patient's peripheral vasculature. Pertinent system number 2. According to the Annals of Oncology, chemotherapy treatment can lead to an increase in bone loss. Due to the patient's history of arthritis and lumbar spondylosis, in conjunction with his past chemotherapy, his risk of substantial bone loss is increased even more. Therefore, the patient's musculoskeletal system should be assessed.